Hey guys, what's going on? Today we're going to discuss the drug Vyvanse, which is normally used for the treatment of ADHD. My topics today will include just some general information on Vyvanse and what side effects you can experience. So if you, your child, or anyone you know is taking this medication or considering taking Vyvanse, this information might be helpful to you. My name is Tyler and I'm a pharmacist with Pharmacy Update. And at the end of this video, we will discuss the precautions and warnings associated with Vyvanse and other stimulants used to treat ADHD. So let's get into it. First off, I just wanted to say that this information in the video should only be used for informational purposes only and shouldn't be taken as medical advice. Before you make any medication decisions, you need to consult your doctor or pediatrician first. With that said, I'm going to cover some general information on Vyvanse first. It is FDA approved to treat attention deficit hyperactivity disorder, more commonly known as ADHD, and also binge eating disorder, which is when a person has recurrent episodes of eating large quantities of food. But I would say the grand majority of people use it for ADHD. Vyvanse is a Schedule II controlled substance in the United States. So it does have some restrictions on how much your doctor can write for at a time, how early you can get it at the pharmacy, and so on. And this is because it does have a high potential for abuse and dependence, especially if it's not being used for its intended purposes. So just make sure if you do get prescriptions for Vyvanse, you keep it in a safe and secure place. Vyvanse is a long-acting formulation, so this is one advantage of this drug. If you take it in the morning, it's going to provide symptom relief for the entirety of the day. And for this reason, it is encouraged to take the dose in the morning. If you wait until the afternoon or evening to take Vyvanse, it may cause insomnia, so just keep that in mind. My next topic here is the possible side effects of Vyvanse. And this is certainly not every possible side effect that you can experience, just the more common ones. First here is insomnia, like we already discussed a little bit. So again, I really recommend you take your dose in the morning to try and avoid this. Next is dry mouth, and this side effect is more pronounced in adults that take Vyvanse compared to children. Around 30% of adults can experience this side effect, and this is compared to kids and adolescents, which is around only 5% can experience this. Upper abdominal pain. This side effect is more pronounced in children. Around 12% of children can experience this side effect compared to 2% for adults. Increase in blood pressure and heart rate is also possible, and we will discuss this a little more on the next slide. Irritability and anxiety are also side effects. Increased energy, and this is why Vyvanse and other stimulants do have the potential for abuse. This, along with the increase in focus, can lead to dependence and abuse of Vyvanse and other stimulants. Weight loss is another possible side effect and a long-term effect that can happen if you take this drug for an extended period of time, especially in children. And we'll get into that more on the next slide. And you can also have the possibility of gastrointestinal side effects, and this includes nausea, vomiting, diarrhea, and constipation. Now I want to cover the precautions and warnings regarding Vyvanse, and really these go for any stimulant used to treat ADHD, such as methylphenidate or Concerta and Adderall. So these are not exclusive to just Vyvanse. These warnings exist for all these types of drugs. First here is the possible increased risk of cardiovascular events. The use of stimulants has been associated with serious cardiac events such as heart attacks, sudden cardiac death, etc. And this is for both adults and children. The American Heart Association and the American Academy of Pediatrics does recommend a thorough cardiovascular assessment before starting treatment with these medications. However, I'm not for certain how serious this risk is. There was a large cohort study published in 2011 that included over 1 million children. And this study was looking for an association between children using these types of drugs for ADHD and cardiac events. And in this study, they actually found no evidence of an increased risk of sudden cardiac death, heart attacks, or stroke in children who use these type of medications. So the evidence is pretty unclear, but just something to keep in the back of your mind. If you have any previous history of heart issues, such as arrhythmias, coronary artery disease, anything of that nature, you really probably should not take this medication because there is a chance that it can worsen your problem. Vyvanse can also increase your blood pressure and heart rate, but really not by much. It's around 2 to 4 millimeters of mercury for blood pressure increase and around 3 to 6 beats per minute for the increase in heart rate. So just monitor this and keep an eye on it to make sure that these don't get too high. One thing I do try to mention to parents when they ask about potential complications of using these medications is the long-term possibility of growth suppression. Stimulants can cause a child to eat less, especially in the beginning of treatment, which could lead to decreased weight and height for the child in the long term. And the higher the dose of Vyvanse used, the higher the chance that this could happen. Along with this, there is some evidence that the bone mineral density of a child might be reduced in children who take stimulants, including Vyvanse. This is the long-term side effect that I worry about the most, the growth suppression risk. So you really just have to weigh the possible benefit versus the risk in your particular situation. One other warning I listed here is the possibility of worsening or triggering psychiatric disorders. So if the patient has any history of psychosis or bipolar disorder, Vyvanse may possibly worsen these symptoms. Especially in bipolar disorder, it can possibly trigger a manic episode. And there's also the possibility of developing new symptoms of psychosis or bipolar disorder. So just keep an eye on this if you or your family member is taking this drug. If there's any history of psychosis or bipolar, you definitely want to use caution when using any of these type of drugs. Well, that's all I have for today, guys. I want to thank you for watching. I hope this video was helpful for you. If you found this video to be informative or helpful, I would appreciate a like. Also, please subscribe to my channel for the latest pharmacy and medical updates and drug reviews such as this one. So thank you guys again, and have a great day.